Alright, we have Rachel here with us today as our model so I can demonstrate how I measure the opening and the lateral excursion range of motion. So this is the little device I was talking about that makes it really easy to measure the range of motion. So first we're going to have you do the opening. I'm going to put this little piece on the bottom teeth here and then rock it up. And I need to come to the other side so I can see where we're landing, and that is beautiful. That's at 40 millimeters, which is exactly what we want. 40 to 50 is our goal. And then for the lateral excursion, I tell patients, go ahead, open your mouth and then very gently contact the teeth with this in between. That or slightly a little bit more apart, that's where I want you to do your lateral excursion. So you're gonna take your jaw and jet it to the right or the left, and I'll measure and see how far we go. So we can see that's 10 millimeters there to the right, and that's 1/4 of 40, so that's our perfect ratio. And then to the other side, same thing, 10 to the left. One trick you can do too is if you're having a hard time following where they go left and right, or their incisors don't match up, if their jaw's a little bit off, you can use eyeliner and just put a black mark on the top and bottom and see how far they're going. Next we'll go through a joint palpation here. So for the temporalis, what I'm gonna do is hook my pinky up all the way into the cheek, and then I'm driving it up into the top of the mouth. Now keep in mind with all this palpation, you have to go really light. Pretty much if I press here and my finger turns white, like that is how much pressure you want. So I'm just going to do tiny little presses into the temporalis muscle up here, looking at my patient's facial expression too to see if I'm pressing too hard or if it feels okay. Then after that one, I'm gonna take my pinky and go to the inside of the molars, all the way till I get to the back molar, and then I'm gonna slide it up in between the top and bottom molars, and you'll feel a little web of muscle, and that muscle's the medial pterygoid. So for that one, I'm just kind of going in this motion here against the muscle, doing some repeated gentle stretching. Good. Alrighty, and then the next one is going to be the Levator Palatini. That one, you have to watch out. There's a little bit of a gag reflex with this one. I'm going to take my pinky on the inside of her top teeth, follow it back towards the palate, and you'll feel a little soft, spongy area too. And for all of this, if you need help, you just want to check with a skilled physical therapist to ensure you're doing the correct technique. And right there. And so for all of these, I can even hold pressure there. I can hold pressure and have the patient open and close 10 times, sort of like an active release technique. And then we can recheck the opening and see if it's improved after that.